Welcome to Hutch Health with the Hutchinson Clinic. Our host this morning is Dr. James Ruhlmann, internal medicine physician with the Hutchinson Clinic.
Good morning. Welcome to Hutch Health by the Hutchinson Clinic. Glad you could join us, where you can hear us every first Saturday of each month. I'm Dr. James Ruhlmann. I'm an internal medicine doctor at the Hutchinson Clinic. I've been there 23 years, seeing general internal medicine. I'm also part of the research department. During each episode that we bring you, we hope that you will hear an interesting topic. Every month we have a new topic that should be something that will affect you or someone you know, hopefully. Today's topic I'll introduce in just a moment, but first we have some clinic news. First and foremost, I'd like to recognize Dr. Tim Crater. Dr. Crater's been at the clinic since 2001. He is leaving the clinic as of the 1st of January. He has an ailing parent and feels like he needs to be closer to home. And as someone who was dealing with an aging mom before she passed last year, doing that at a long distance is hard, so I completely understand. He's been active at the clinic. He was president of the clinic in 2008. He's been a board member. He's head of the quality committee at the clinic. He's also been an associate professor at the University of Kansas. He's director of hospice, Reno County. He's been chief of medicine at the hospital for 3 years. Also heavily involved in our clinical research department. He's done a lot for the community as well. I know he's been very active on multiple boards in the community. We do wish him the best in his move and in his new practice. I know he is grateful for his time here in the Hutchinson community, and for all of his patients, he will definitely be missed. And for those of you who are patients of Dr. Crater, the rest of us in the internal medicine department would be happy to take you as a patient and continuing providing your care. Dr. Patry, who is our newest physician, you met her a couple of weeks ago on the radio, or a couple of months ago on the radio. She's going to be taking the large majority of those patients. Dr. Crater, you will definitely be missed. You've been a great partner and even a greater friend. As a reminder, to our Medicare-age patients, we're offering another information session. This one will be on December 13th in the Ambulatory Surgery Center. It is 5:30 to 7. It's the north side of the main campus, which is across from the hospital. It's a great opportunity to learn what benefits you're eligible to receive. Again, that's December 13th, 5:30 in our surgery center on the Waldron campus. You do not need an appointment. You don't need to RSVP. Just show up if you need to know more about what's in store for Medicare for you. And for those of you who have school-age and college-age kids, you might be thinking ahead to the Christmas break that they're going to be having. It'd be a great time to make an appointment for a general well check with a pediatrician or primary care doctor, get them up to date on the immunizations, see dermatology, ear, nose, and throat, allergy, get the eye exams or even GYN if you need to. All of those appointments will be available over the holidays as well. Also, it's a hazardous season, as you know. The ice has come. The ice and snow have showed up. It's a quick reminder, be safe. If you do happen to slip and fall on the ice, don't forget that we do have walk-in care areas. We have one in Cheney, one in South Hutch, one on Main Street, another one on the Waldron campus. The one on Waldron is open until 8 p.m., so if it's an after-hours fall, we can take care of you then as well. In addition, if you're on multiple medications, our pharmacy is offering a great service. I have seen this. It's called Medicine on Time. It prepackages your pills to as often as you need them. If you take them twice a day, you get a morning pack and an evening pack. If you take them 3 times a day, you get a morning pack, a noon pack, and an evening pack. It'll put all of the pills that you're supposed to be taking at those specific times into one bubble. So you break open that bubble, you take the pills out, you take your pills, and you don't have to worry, did I take my pills this morning or not? You don't have to worry about, did I get all of my pills or not? Because they're all right there prepackaged for you. That is a free service that we are offering at both of our pharmacies, the Waldron location and the 1100 North Main pharmacy. So if this is something you struggle with, you really might want to check into that service. It's a fantastic service. Also, it's not too late for your flu shots. If you've not gotten your flu shot yet, please come on in and get it. And then finally, I just want to make a real quick announcement. This is something I've been seeing and hearing in my practice quite a bit. People are asking me all the time about the new shingles shot. It's an excellent vaccine. It's 2 shots instead of the old 1 shot. It's called Shingrix, and It's a fantastic vaccine that I would definitely recommend. The biggest problem is there's a nationwide shortage on it. So we don't have any. Nobody else does either. Hopefully, by next year, we'll have some. The GlaxoSmithKline Beecham did not anticipate the demand for it and fell behind very quickly in their manufacturing of it. So 2019, rather. I'm a decade behind here. 2019, we're expected to have some. So now for today's show, I want to welcome our guests from Horizons Mental Health Center. You know, this time of year is supposed to be festive, and for many people, it's actually the hardest time of year. People with the winter blues or the holiday loneliness, the Hutchinson Clinic is pleased to partner with Horizons for on-site behavioral health, which means you can see a counselor while you are in the building to see your other physicians. I would like to welcome Laura Martinez and Beth Akins. Welcome.
Hello.
Hello, thank you.
All right, so both of you have a lot of letters behind your name. It's LSCSW. Can you tell me what that means?
Yes, LSCSW stands for Licensed Specialist Clinical Social Worker. It means that both Laura and I have received special supervision, extended supervision. We've both practiced social work for several years, and so we're able to practice independently. Okay. As social workers, I'm sorry.
Yeah, no, that's great. So where did you do your training?
I did my master's work at the University of Kansas.
And I earned my master's at Newman University.
Very good. Down in Wichita?
Yes, in Wichita.
Fantastic. And I almost shudder to ask the question, how long have you guys been doing this?
I've been practicing at Horizons for 29 years.
Wow.
Yeah.
Very good.
And I have worked in mental health at Horizons for 24 years, minus a few sabbaticals, having a private practice and working for another agency.
All right. So as an LSCSW, you got more letters behind your name than I do. Okay. So what kind of services can you offer then?
What we do at the clinic is called a brief intervention. It's kind of a mini therapy session to find out what's going on and what can we do to help, whether just listening to someone while they process stressors that are going on, giving them some coping skills that maybe they didn't have when they walked through the door, or accessing some resources for them in the community, whether it's Horizons with private practitioners or other community resources.
Okay, so some counseling will happen, and then getting the patient into services that they're going to need.
Yes.
Okay.
For a lot of folks, just that 1 or 2 sessions there at the clinic with behavioral health is enough to get them through a situational depression or some anxiety because they're changing jobs or moving. For others that need ongoing services, then we do get them connected to Horizons or other resources in the community.
Okay, and you've kind of referenced this a couple of times already, but where are you located then?
I am located right in the Hutchinson Clinic. We've embedded Horizons right there. So when you see your doctor and you're feeling stressed, depressed, anxious, you can either ask to see us or your doctor can suggest it, and I will come right to the exam room and see you when the doctor is finished. If that doesn't work out, if Beth and I are both with other clients at that time, then one of us will call you and schedule a time for you to come back in and visit.
Fantastic. And actually, it's something I know I've used in my office quite a bit, and you guys have both been very responsive. And it's really nice because, you know, the person's right there, and they're ready. Right. You know, they've already said to me, look, doc, I'm having issues. I need to be talking to somebody, or I can suggest, hey, do you want to talk to somebody? And they're ready. They're ready to talk to somebody. And it's very good to be able to just call you guys up and say, hey, can you please come to talk to Mrs. Jones? She needs help. She's struggling with XYZ.
Right.
You know.
The nice thing is that we're really trying to take a look at the whole person, and we're not just throwing a pill at somebody and saying, hey, go on your way. We're really trying to help them with some coping strategies, some additional support, so that we're really taking a look at the whole person and doing everything that we can to try and help them feel better physically, but also then emotionally, so that overall they can battle that depression or battle
Yeah.
that anxiety and not have to struggle with that anymore.
Yeah, and you mentioned something very important there, the whole person.
The whole person.
My specialty, I guess medicine in general, is probably as guilty as any of just, like you said, throwing the pill at somebody. We are very pressured in what we do to make sure that we keep on time. You don't want to be getting behind
Right.
in your schedule. So the temptation is always there just to, quote, throw the pill at somebody. And, you know, I'm not saying that it's certainly not ideal. And it's not something we really do. But having you guys there to be able to say, hey, let me help you with some other strategies that are going to help you.
Right. Let's provide some additional tools so
Absolutely.
that you've got the medication on board that can help with one thing, but here's some additional tools so that we're really doing a wide variety of things and not just one thing or the other, but really the whole toolbox.
Yeah, it's the whole package. Yeah, absolutely.
Right. Because the medication is extremely helpful as well. We don't want to forget how important that the medication can be.
That is true. And so what type of patients will you guys typically see?
We see anyone and everyone at the clinic, from pediatrics, new moms, pregnant moms, elderly. Anyone who is a patient at the Hutchinson Clinic can access our services.
Fantastic. Any particular disease process, anxiety, depression, all of the above?
We see a lot of depression and anxiety, especially around this time of year.
Yeah, definitely. And that's what we kind of talked about at the opening. This can be the holiday blues. It can be a hard time for some people. Normally, you would think that it would be a time of festivities and getting together and seeing family and enjoying each other. But for a lot of people, it can be very hard. And we're going to talk a little bit more about this on the other side of the break as to what kind of services you can offer and what you need to see from the patients.
Still haven't had your Medicare annual wellness exam? Don't wait. This visit is a covered service and is recommended annually for all Medicare age patients. In order to get in before the end of the year, call 669-2500 and ask to schedule your Medicare annual wellness exam. This appointment is different from your regular visits and can help identify important vaccines or tests that are missing from your preventative care regimen. Your health is important. Please call the Hutch Clinic today to schedule this covered service.
We're back with Hutch Health. I'm Dr. James Ruhlmann with Beth Akins and Laura Martinez. Glad you could listen to us. We were talking before the break about types of patients typically seen, and I want to make sure that it's not the idea that it's only anxiety and depression. There are some other situations in which your services would be helpful. And could you elaborate on that a little bit?
Of course. Some of the other services that we provide at the Hutchinson Clinic in collaboration with the doctors would be new diagnosis. When someone is given a diagnosis, whether it's in oncology or diabetes, having to change their lifestyle and emotionally having to accept what does this mean and where do I go from here. We also work with people on compliance to see why aren't you staying on your medication or why can't you follow through with the plan. Who knows what's going on that we can visit and find out and just help people live happier, healthier lives.
Yeah, that's important. And the compliance thing you talked about is huge. It is astounding to me the number of patients that come back to me and they've got the same problem. And I ask, well, did you do what I told you to do last time? Well, no. Well, I'm not surprised it hasn't gone away. So compliance is definitely huge. Is there anything, say you're seeing somebody for an appointment, is there anything you'd like the patient to bring to the appointment or do before you see them? Is there anything they need to do?
I don't think there's anything they need to bring with them or do. They just need to be prepared to visit. The average brief intervention is 15 to 30 minutes. And just to get honest with themselves about why they're there and what we can do to help.
Yeah. I think me being able to call you guys is a huge part of that, because at the time that they're asking for help, they're ready. Mm-hmm. They're ready to talk to you.
Right.
And to be honest with you and tell you what really is going on. And I've seen this multiple times over my career where someone comes in with the same complaint, anxiety, depression, whatever, nausea, headaches, pick the diagnosis, and you're treating it, and you don't get anywhere. And then on the 17th visit, all of a sudden you find out that, well, actually they're really dealing with the fact that their cousin just committed suicide.
Right.
And well, that changes things. That changes things a lot because, well, I can't fix that, but we can certainly help people cope with that. And that's definitely where you guys come in.
Right.
Now, how does payment work on this? Because obviously it's not a free service. How does payment work?
We do accept insurances. Laura and I are both paneled on most insurances. So anybody that comes to see one of us, we do open up a chart at Horizons, and then Horizons will bill the insurance company. Some insurances have a copayment that's required, and so it's all dependent upon what the insurance company's mental health coverage looks like.
Yeah.
We don't collect any kind of copayment or anything when Laura and I see the person. So the person receives a bill from Horizons. And then there's also sliding fee scales. Horizons is a community mental health center. We are funded by state funds and county funds, and so there are sliding fee scales that are available for people if they don't have insurance. And so we're able to offer that to people because we want to make sure that mental health services are accessible to people regardless of their ability to pay. And so Laura and I will help work with people. Our business office is wonderful about working with people to help make sure that they can figure out how to make that happen, make the payment.
So financial resources should not be an issue.
Absolutely should not be an issue for someone.
And that's huge.
Right.
So I kind of walk through it when I see somebody in my office. If you've been to anybody's office at the clinic this year, you will probably remember the PHQ-2, which is the Patient Health Questionnaire 2, and it's a series of 2 questions. Oddly enough, that's what the 2 means. And it is something that's been around since 2003. It was validated in 2003, and it's a screening questionnaire for depression. And I'm holding up for anybody that's watching this on Facebook. It's a screening questionnaire for depression, just 2 questions. And the patient will rate it on a scale of 0 to 3 in terms of how many days they struggle with this. The first question is little interest or pleasure in doing things. The second question is feeling down, depressed, or hopeless. We'll have them rate that 0 to 3. If someone scores greater than or 3 or greater, then it's likely they're having issues with depression. So at that point, I'd move on to what's called the PHQ-9. Same thing, only 9 questions instead of 2. The patient rates these, and the higher they score on these PHQ questionnaires, the higher is the likelihood that they're having depression. And at that point, they would need medical therapy and certainly counseling therapy. They'd need to be talking to someone about these coping techniques. So let's say I do this, I see someone, they score a 4 on the PHQ-2, and then they score a 16 on the PHQ-9. So I call you guys, and they test positive. How soon can you see them?
I can see them right away, hopefully. If I'm not available, then we usually have the nurses call Beth to see if she's available.
And Beth has been very responsive as well.
And so more often than not, we can see you right then that day when you've taken this questionnaire, your doctor has said there's an issue. We can talk about it right then and see what's going on.
And so, all right, so now I've called you. You guys, one of you is in the office with my patient now and talking to them. What kind of therapies are you going to recommend?
It really depends on what's going on with the person. Our goal with the brief interventions is to provide an early intervention. Hopefully, we're getting in to see the person early on in if it's with the depression, early on with their depression, we can just listen to their story, hear what's going on with them, provide them some support. Laura and I have a lot of coping strategies for dealing with depression or dealing with anxiety, whatever's going on with them. With what we do, we typically will see somebody up to potentially 3 times. And like Laura said earlier, for most people, that's as much as people need.
Yeah.
For some people, and as you were alluding to earlier, a lot of times, you're seeing that person over and over and over. The interventions that you're providing aren't working, and it's because they've got some of these deeper issues that they've not, for whatever reason, they've not been willing to disclose before.
Yeah.
And so sometimes this is their first time really sharing that deep underlying. And so when that comes out, if Laura and I assess that what they're really needing is more specialized care, therapy, longer term therapy, then what we do is help them find the appropriate therapist to get them that longer term treatment.
And again, this is not instead of medicine.
No, and
This is in conjunction
oftentimes it really takes both.
Sure.
Medication for a lot of people is really the key to help them begin to feel better.
Yeah.
But medication alone often can't do it. You need the talk therapy, and oftentimes talk therapy alone can't do it. You need the medication.
Right.
And so the two of them together, which is why this partnership is so nice, because we can really focus on that whole person.
Right.
We can address any of the medical issues, the chemical imbalances, or
the relational issues too.
And then the relational issues as well.
Yeah. I mean, if someone's living in a really, really bad situation, there's no medicine that fixes that.
Right.
None. They need someone to come alongside them and say, you know what, this is a really bad situation. Maybe you should think about doing this instead, which is what I think you guys can do, because you've gained their trust. Mm-hmm. You've gained their trust through time and through just talk.
Right.
So
Absolutely.
That's huge. Now, so this is more about kind of the holiday blues as well. So why are the holidays hard?
Oh, gosh. There's so many reasons
Where to
why
start?
they're hard. It's a stressful time of year.
Sure.
I think people put a lot of expectations on themselves.
Yeah.
Social media, television doesn't help. You have to have the perfect holiday and buy the perfect gifts. And so I think it's really important to step back and take a look at, what does Christmas mean to you? And it can be anything you want it to be.
Yeah. Now, who here has the perfect family?
No one I know.
Exactly. So I'll just tell you right now, your perfect Christmas is over.
Right.
Okay?
Exactly.
It's not going to happen. So yeah, you're right. Laying out the expectations. Do you feel more like it's an anxiety issue or a depression issue, or do you see both? Do you see a smattering of both?
I definitely see both.
Mm-hmm.
I think that people put an awful lot of pressure on themselves to do way more than they have time to do, to spend more than they have time to spend, to make things more perfect than they should be. Laura and I were talking on the way over that in 20 years, nobody tells the story about that perfect turkey that came out of the oven,
that
but
is true.
Everybody laughs about the funny things that happen,
right.
the failures, the things that don't turn out like you want them to. And so that's where it's good to be flexible and to have fun and to just relax and breathe.
So if someone is having a hard time, how do they get in touch with you?
They can call the Hutchinson Clinic, ask for Laura Martinez. They will be directed to my line, and more often than not, I answer that personally. If they leave a message, I'll try to call them back as soon as possible, usually within the same day, and schedule a time that's convenient for them to come in and visit.
Well, fantastic. Thank you guys for coming out. It brings us to the end of this show. You can hear us here again the first Saturday of every month. Be sure to tune in. You can also listen to the show as a podcast on our website, hutchclinic.com, under the Media Resources tab. If there's something you would like to hear more about, or if you have a question, please feel free to submit your questions through Facebook or to the Hutchinson Clinic. Thank you so much for joining us this morning.
Tune in on the first Saturday of every month at this time for Hutch Health with the Hutchinson Clinic.